Africa has a profound need to expand its capacity to manufacture pharmaceuticals that are required to meet both urgent and routine health needs. Furthermore, it's clear that this is one area where the continent should be more self-reliant in order to provide sustained healthcare for its citizens and alleviate large burdens on Africa's healthcare budget and in preparedness for combating new health emergencies or even pandemics. The AfCFTA-anchored pharmaceutical initiative aims to provide a blueprint for the local production of medicines and medical equipment across the continent. By mobilizing investment and capital to develop domestic production of essential medical products and strengthening the supply of essential pharmaceutical products through pooled procurement and promoting a harmonized regulatory and quality framework for pharmaceuticals in Africa.
So the AfCFTA-anchored Pharma initiative was meant to prove the concept that the AfCFTA can deliver on its promises by addressing important sustainable development goals. In this case, sustainable development goals related to maternal mortality issues and neonatal and child mortality issues.
So when we started the project in 2019, we initially started with a report. We said, you know what, there's significant correlation between health and economy, especially when you look at Africa and how today we import, still today, more than 95% of our pharmaceutical needs into the continent, and why constantly do we depend why don't we have an industry that creates jobs for our population, women, and makes sure we access medicine and others, and we can actually improve government fiscal space.
En fait, donc, cette initiative touche des points vraiment très significatifs dans le cadre de la production médicamenteuse et des intrants en santé. C'est-à-dire qu'il y a la promotion de la production locale. Deuxièmement, il existe également la promotion de la réglementation de la production des médicaments. Et vous savez pertinemment, lorsqu'on va parler de la production de médicaments, il existe 4 phases techniques. D'abord, la production intellectuelle, communément appelée les essais cliniques. Deuxièmement, la production industrielle. Et troisième étape, c'est la distribution et la conservation. Et enfin, la pharmacovigilance.
As you know, that our mandate within ECA is to promote economic and social development for Africa. And we also do this through translating our ideas into action. And we talk of the Africa we want, leaving no one behind. We cannot do that without a healthy population. And we're also looking at, when you're importing your medicines, you can't control things like quality. There are stockouts because of long time frames in between. So we wanted to showcase to member countries how they can address these challenges in health sector, leveraging on the AfCFTA, which had been just ratified.
The project was tailored in a business-like blueprint, which would make ECA, with its expertise in economic factors, would contribute to the already ongoing work by other specialized entities. So the pilot initiative proposed localized production and a centralized food procurement, and also looking at a regulated or harmonized regulatory standard and quality framework. So generally, the motivation was based on the substandard falsified maternal and child health products that are existing in countries that needed to be managed and controlled, both in food procurement, local production, but also having regulatory environment that would improve the quality.
In concrete terms, what we would want to see in the medium and long term is bringing down the costs of medication, broadly defined on the continent. But not just bringing down the cost, but also ensuring that we get the medicines or medication are available to the average Africans. And then lastly, that the quality is there. So there are three things. There's cost, there's availability and affordability.
We are talking about access to quality medicines and at a cost-effective price. Because if you're buying a product in Nairobi and sending it to Tanzania, for example, the only nominal cost of transport. If you buy a product in India, for example, there is the air, the freight costs, which are rolled into. So, and the other issue is quality. You are not sure what quality of a product that you are getting. Therefore, this is the best initiative for Africa.
WHO has been collaborating with the Economic Commission for Africa and other partners since the very beginning on the conceptualization and several meetings and activities related to the Pharma initiative. The Pharma initiative is basically about pooled procurement of health commodities in the continent. And the idea behind it comes from the fact that countries in the continent have various sizes, various populations, and various geographical locations, all of which have impact on their negotiating power and their ability to procure quality essential medicines at the right price.
Leveraging on implementation of the AfCFTA and AMA for enhanced harmonization of trading commodities and building capacity in pharmaceutical provisions, quality and supply are key tenets of the AfCFTA-anchored pharmaceutical initiative. Furthermore, the initiative is built on three key interlinked pillars: local production, pooled procurement, and harmonise regulatory standards and quality framework, with these objectives that are already being rolled out in 10 pilot countries.
So the coming into force of the African Continental Free Trade Area was also an opportunity for us to say, okay, we can work together. And that time, UNECA reached out to us as AUD and NEPAD, but also in partnership with the African Union Commission to see what components of the pharmaceutical manufacturing plan for Africa can be used to expand the market, to facilitate trade among the countries on the continent. Since that time, we've been working with UNECA to elaborate what needs to happen.
The rules of origin of AfCFTA indicate that Africa must be able to produce and depend on products from our own continent. It be fertilizer, it be food, it be cars, so the same with pharmaceuticals. So the arena of local production was pronounced not necessarily by ECA, but by the heads of state, of government, and heads of state of various countries in Africa, who pronounced during their meeting, they said, we need to produce pharmaceuticals locally.
Lorsque nous sommes dans la promotion de la production locale, c'est-à-dire que et les chercheurs et les industriels sont en Afrique. Et certainement, le coût des produits va être réduit. Et donc, les médicaments qui vont être produits vont être à moindre coût et accessibles par la population.
So the first thing, you want to have local production. So this pillar of local production is meant to be that for building resilience in the health systems within the continent. The second pillar relates to driving the market. So anybody who wants to produce within the continent must also know he or she has a buyer. So the second pillar relates to pooled procurement. So the two pillars are interconnected. One shapes the market, the other one produces for the market. And thirdly, the third pillar relates to regulation. It's supposed to deal with this issue of ensuring that we have one regulation for the pharmaceuticals. So those are the three main pillars, and they are all interrelated, both for market shaping, for producing for the market, and assuring the standards within the market.
We got initial interest from those 10 countries that today we're doing our project in, but the countries said, for example, Seychelles. It started with Seychelles. Seychelles told us, we're done. Not only we import 100% of our pharmaceutical products, and at a price that's maybe 5 times more than the average larger country in Africa. We said, what if we had a grouped demand to our suppliers? What if we identified the suppliers, where are we importing them, at what price? And we found out, and you'll see some of the feasibility results, that actually, should you negotiate with the suppliers together and add all of those volumes of demand, you can negotiate a price maybe a third less.
Another aspect of pooled procurement, which is very important, is that with a higher number of participating countries, the prospects for success and also the negotiating power of the pooled procurement mechanism increases exponentially. So initiatives such as the Pharma initiative should be very much encouraged, because it is looking at a continental pooled procurement mechanism. For example, some of the countries selected in the 10 pilot countries for the Pharma initiative. For example, Ethiopia is a large country, a very populous nation, and within the 10 pilot countries also you have Seychelles and Comoros, which are smaller nations with less negotiating power for the medicines they need. So in pooling the procurement, this improves drastically the potential of these countries to be able to secure the commodities at the right price and also at the right time when they need it.
Well, Seychelles is one of the 10 pilot countries of the Pharma initiative, and the objectives of Seychelles being a key member as one of the pilot countries is that we are a very small state with a population of 100,000 thrown in the middle of the Indian Ocean. So we depend on importation of our products, and being a small country, the quantities that we require are not interesting for most of the manufacturing pharma companies worldwide. So we depend a lot on third parties, traders mostly, so that they basically put a profit margin on the goods and which we have to pay for in addition to the direct manufacturing costs. Joining the pooled procurement initiative gave us the possibility of being able to procure good quality, safe, efficacious medicines for our nation at good prices. And this was one of the main reasons why we wanted to be part of the Pharma initiative.
COVID validated our thinking that, we need to make sure that there is some adequate local production on the continent to ensure that our population is healthy, because it's a matter of now health security and economic security, because everything stands still during COVID. So that addresses all these issues that we're talking about: quality assurance, job creation on the continent, and then supply chains. All those things will be addressed with this kind of a framework within an initiative like ours.
A recent workshop in Nairobi brought together key stakeholders of the Anchored Pharmaceutical Initiative, comprising of 10 pilot countries' representatives, pillar and national consultants, and analysts and partners to engage on policy recommendations and to set concrete actions for the next stage of the initiative. The 3-day workshop also examined key results of Phase 2 of the initiative and the current efforts to harmonise medicine regulation, assess manufacturing capacities in pilot countries, and proposed action plans for Phase 3 of the initiative.
Well, overall, the meeting, as you are well aware, was intended to kind of bring to closure the first two phases of this AfCFTA-anchored initiative, and to begin to map out the way forward in terms of what we describe as phase 3. And when you talk of recommendations, the overall recommendation is that we need to move. The third phase needs to focus on doing some concrete, tangible deliverables that would make a difference in the lives and livelihoods of the average Africans.
The AfCFTA-anchored pharmaceutical initiative represents a watershed for the pharmaceutical industry in Africa to utilize the newly integrated continental market framework while building capacity, supply of pharmaceutical products, and ensuring provisions of quality pharmaceuticals for Africa's specific medical needs, which in turn contribute to the continent's development goals, predicated on the foundation of healthy and thus productive citizens in all African member states.
Given the huge disease burden on the continent, it meant that the continent, the health, even as we have this youth dividend, a large population, but if that youth population continues to be sick, it cannot produce. It becomes a liability. So those are the considerations that informed this initiative.
So initiatives such as the Pharma initiative, through its function of consolidating demand and increasing the negotiating power of countries, and also consolidating the needs and the requirements of countries for essential health commodities, are indirectly an enabling factor and promoting local production through encouraging local manufacturers to produce products which will very likely be available to more than one country in the continent, thus having a very strong market shaping effect to the benefit of the populations. And the whole initiative all aim at increasing health system resilience and promoting health security in countries, especially in face of emerging health needs or threats or emerging diseases.
We need to make sure that we produce medicines on the continent. I think that's what we are talking about. We are talking of free movement of goods and services. We are talking of a healthy and productive population, and we can all achieve this using frameworks like the AfCFTA and African Medicine Agency.